Hi, this is Jocelin. I'm here at a Fresh Med Spa with Denise, and yesterday Denise had a CO2 resurfacing procedure on her face. Today we're going to actually talk about some things to do to help improve recovery after facial procedures. Sometimes patients will have laser procedures, resurfacing procedures, or other things to the facial area, and there's some swelling that occurs. One thing that we like to educate our patients on is how to help reduce the post-period swelling. And Denise is going to demonstrate a technique that we like to use. First, she's going to find the little notch under her clavicle. It's a little dip just adjacent where the clavicle meets the shoulder. Put one finger in there, and you're going to start massaging 50 times in a circle outward. The pressure should be very light, just enough to make the skin move. You don't want a lot of pressure during this. 50 times, and then you're going to move on to the next move. Our next move, you're going to start and find the top of the collarbone on both sides. Go ahead and demonstrate the move. And you're going to do a gentle sweeping motion out. This move is also 50 times. Very gentle, just enough to have contact with the skin, moving things outward. The third move is going to be finding the top of the clavicle on each side. And it's the bony prominence where the clavicle meets the center of the sternal notch. The sternal notch is a little dip right here in the middle. One finger on each of the bony prominences with light pressure, just enough to move the skin upwards and outwards in little circles. This move is also done 50 times. Next, you're going to use a sweeping motion. You're going to place your hands right behind your ear and do a sweeping motion down. So just think of draining any extra fluid. You're going to help it find its channel and work its way out. This move is also done 50 times. The next move is going to be at the base of the skull. At the base of the skull, there's something called the occipital ridge. It's the bony ridge. You place your fingers on that ridge and sweep inwards and down towards the neck. On the ridge and sweep down. This is also done 50 times. The next move, you're going to make Spock fingers. And you're going to separate the third and fourth fingers, and you're going to place it behind the ear. And Denise is going to demonstrate this move. This is also a light sweeping motion from the ears down the jawline. This move is done 50 times as well. The next move is going to be right on the mouth. You can see her position on her hands. Go ahead and start. And you're going to tap, tap, tap your fingers, moving from the center outwards towards the ear. And it's a very light tapping fingers right along the lower face, almost like piano keys. This is done 50 times as well. All of these moves can then be reversed in the reverse order that you've done it. So after piano keys, you go back to the Spock ears, move downward, occipital ridge, move downward, the neck moving downward, the clavicles, the sweep along the clavicles out, and then right at the little dip in the shoulder. So this will help drain any swelling that is in the face after any head and neck procedures. You can do this as often as every 2 hours. 2 to 3 times a day is what most patients find comfortable to do. Remember, the key is not using a lot of pressure. We hope you find this helpful. Feel free to call us if you have any questions at a Fresh Med Spa. Have a great day.